Hello again. Today we're going to talk about the unthinkable with Victorian things, such as surgery. Oh, the good old times of doctors cutting your leg off with anesthesia. Let's begin. The idea of surgery without anesthesia is unimaginable, but that was a grim reality in the past. In 1847, chloroform was introduced in Britain and used for the next 50 years. A Scottish person called Sir James Simpson, not with the Simpsons cartoon, was first to try chloroform, and after passing out in his dining room, he realized that he could utilize its powerful fumes for practical purposes. Not sure why he was using it in his room, but let's continue. Simpson invented a mask that would be saturated in chloroform and then placed over the patient's face. After only a few minutes of preparation, surgery would begin. Even Queen Victoria herself was given chloroform for the birth of her last 2 children. That's a way to give birth for memory. Use of chloroform as an aesthetic eventually declined. I wonder why. In Victorian surgery, there was a lot of blood from a wound. A hot iron might be used to stop the bleeding from flowing. Obviously, this was not pleasant at all. Alternatives to causterize the wound had been found long before the Victorian era. The scientific journal, Philanthropic Traditions of the Royal Society, reported on one such alternative way back in the 1670s. Surprisingly, they even recorded the surgery as a cheerful experience. The leg, therefore, of the poor woman being cut off immediately, the person was dressed with some linen, dipped in a liquor, with a compress on it, and a bandage keeping all close against the arteries. The success was the blood was still. Without any other dressing, instead of complaining, they are wont to have a limb cut off, and the mouths of whose arteries are burnt with a hot iron, or to stop the blood from flowing at all. This patient looked very cheerful in the end, and was free from any pain as well, and slept 2 hours after, probably from the pain. And also in the night following, and from that time hath found herself still better and better without any returning of bleeding, or any ill accident afterwards. Surgery in the Victorian era was a crazy time to say the least. It was also lethal, but not due to the fast hand surgeons. Instead, it was the high probability of infection afterwards. According to medical historian Dr. Lindsay Fitch Harris, surgeons never washed their hands. Lovely. So I'm surprised that they didn't have dookie in their hands when they were doing surgery. They probably did. Lovely. These places became sort of a slow-moving execution room for the patient because they would develop diseases and so forth, such as operative infections that would kill them, sometimes within days, sometimes within months. You never know. It's like a roll of the dice. It's a trouble game for surgery. Despite the pungent smell, doctors also believed that pus emitting from post-surgery was a sign that was healing well rather than it really was, which was bad. The result of a bacterial infection was probably more likely. The high death rate was just put down to ward off high fever. It wasn't until surgeon Joseph Lister, 1827 to 1912, introduced antiseptic practice and sterile environments as well in hospitals that infection rate began to lower. Lister is now known as the father of antiseptic in surgery. Also on a side tangent, he was condemned into a hospital and went crazy because nobody believed him that washing your hand was good. He'd work out great in 2020. From the end of the Napoleon era in the wars in 1815 to outbreak of the Crimean War in 1853, there was a brief period of calm in Britain. During the battle days, barbers did more than cutting hair. They were enlisted as surgeons and expected to perform operations on wounded soldiers since they were so fast at what they were doing. Despite no extensive knowledge of or formal training that extended further than hair cutting, a barber surgeon would be tasked with pulling teeth, bloodletting, and also perform basic surgery outpost. Surgeons and barbers were separated as 2 different professions. Well before the Victorian era, patients in need of surgery would still sometimes approve of this method, as they had the sharp tools needed. Even in modern times, the red and white poles outside of a barber shop are a symbol of the blood-soaked napkins they use during their bloodthirsting renegades. If the thought of blood-sucking leeches is enough to make your skin crawl, then the part may make you shudder a little bit. The heart pumps 5 liters or 1.3 gallons of blood through your system, all around the body in just 1 minute. And severe blood loss can lead to shock or even death. Luckily, our body has a clotting system in place just to prevent this from happening. However, during the Victorian era, the ancient practice of bloodletting hadn't quite died out just yet. Of course it hasn't. Victorians are special. Victorian surgeons would use live leeches to suck the blood from the patient. The practice of bloodletting was harmful as it could cause anemia, but doctors overlooked this for thousands of years. Leeches. They're fantastic. Imagine having your leg sawn off because of a broken bone or fracture. Then the limb is dropped into a bucket of sawdust by your side as you lie on the operating table. And people observed started to applaud, as most of these surgeries were in front of a live audience. As mentioned previously, this could all occur without anesthetics. So it's no surprise that patients would hope for an efficient and quick doctor. Dr. Robert Linston, from 1794 to 1847, one of the most famous surgeons in history. He was also known as a fast knife in the West End. He amputated his patient limbs in great speed and often called out during surgeries, "Time me, gentlemen, time me." On average, only 1 of every 10 of Liston's patients died at London's University College Hospital, which was considered a great success. He had a rate of 300% death rate. Math is fun. As other surgeons lost 1 in every 4 on average, patients would camp outside his waiting room in hopes that he would consider them for surgery. If you were lucky enough to be rich during the Victorian era, a family doctor would treat you at home from the comfort of your own bed. The poor would be hospitalized, and it was the role of the government, not the medical staff, to decide who would be admitted. Only 1 day a week, one put aside for accepting new patients, and they would typically fall into 2 categories: either incurable, for infectious diseases, or lunatics, who suffer from mental illness. That seems about right. Starting in 1752, the rule of St. Thomas Hospital in London was no patient was to be admitted more than once with the same disease. Operating rooms would always be situated on the top floor of hospitals to take advantage of the sunlight that would beam through the window in the roof, to get more light, of course. If patients were too poor to pay for their treatments, spectators would be invited to view the procedures. For others, they would have to seek financial support from their parish or willing patron. So even back then, they had patrons. British surgeon Sir Berkeley, from 1865 to 1936, recalled how his fellow surgeons would turn up to work, entering the operating theater, and put on old surgery frocks that were stiff with dried blood and pus. Victorian surgeons were known for wearing their blood-soaked garments with pride, and they also carried with them the stench of rotting flesh. Yummy. It's like a butcher. They also wore these aprons home. Being a surgeon was not considered the noble profession as it is today, and the hospital bug catcher, who had the job of ridding the mattress of lice, was paid more than a surgeon during that time frame. Due to the high mortality rates, hospitals were known more as houses of death than houses of healing. That's why I have a fear of doctors. While patients would squirm on the operating tables and even attempt to run away during the practices of painful procedures, onlookers would be there to enjoy the whole show, as if it was a Marvel movie. Operating in front of an audience was nothing unusual during that time frame, and the risk of the germs entering the theater wasn't even thought about during that time. Historian Lindsay Fitzharris, author of The Butchering Art, Quest of Transform the Grisly World of Victorian Medicine, writes, "The first 2 rows were occupied by the other dressers, and behind a second patron stood the pupils, packed like herons in a barrel, but not so quiet, to say the least, as those behind them were constantly pressing on those before and were constantly struggling to relieve themselves of it, and had not infrequently to be got out exhausted from the show itself. There was also a continuous calling out of heads to heads to those about the table whose heads inferred with the sightseers. The painful cries of the patients and loud crowd watching the surgery could be overheard from the street many floors below." Another one, in 1865, surgeon Dr. James Berry died. His gravestone read, "Dr. James Berry, Inspector General of Hospitals, considered one of the most successful surgeons in Victorian history. Barry was actually born Margaret Ann Berkeley and had no way of fulfilling his dreams in the operating theater, as women were denied a formal education. He enlisted in the army, and in 1826, he carried out a successful section in Cape Town. 7 years before the operation was performed for the first time in Britain. Known for his bad temper and his anger, which is excellent for a surgeon, Florence Nightingale, and following his death, she said, after he was dead, "I was told that Barry was a woman. I should say that Barry was the most horrid character of all." It wasn't until a domestic member of staff cleaned his body after his death that the truth was revealed. His gravestone was already listed and remains unchanged, so I'm guessing he was a she. Perfect for modern times. So what do you think of these bloodlust Victorian era people? I find them quite fascinating. I love the blood-soaked robe as much as anybody else in this time period. Imagine coming home from work and being like, "Hi honey, do I stink? Do I need some cologne?" No? Fantastic. Anyway, thanks for watching. Have a great one. Happy doctor visits. Bye.